Hi guys, my name is Yusfila Febriyanti. I'm from Syariah Ekonomi Law Study Program. Here I will parody the speaking style of one of these presenters. Before we continue, let's look at the following video.
If you are a parent, chances are you're worried and have questions about just how contagious coronavirus is and whether your child could be at risk. Misinformation has cropped up across the internet since coronavirus, or COVID-19 as it's now called, began spreading. So we asked UNICEF's health experts to get us the facts. Here are 6 things they think you should know. The virus is transmitted through direct contact with respiratory droplets from an infected person and by touching surfaces that are contaminated. Tell your children to maintain at least 3 feet of distance between themselves and people who are coughing, sneezing, and have a fever. Symptoms of coronavirus can include fever, cough, and shortness of breath. In more severe cases, infection can cause pneumonia or breathing difficulties. More rarely, the disease can be fatal, but that's mainly among older people with pre-existing conditions. Wash your hands frequently for at least 20 seconds using soap and water or an alcohol-based hand rub. Cover your mouth and nose when coughing or sneezing. Use your elbow, like this, or use a tissue and then throw it in the bin immediately after. Not really. If you don't have any symptoms, there is no need to wear a mask. Hand washing is actually more important. If you're coughing or sneezing, it's advised that you wear a medical mask to help protect others. For now, there isn't enough evidence to support whether the virus is transmitted from a mother to her baby during pregnancy or what impact this might have on the baby. To date, there is no specific medicine to prevent or treat the new coronavirus. So the best thing you can do is practice basic hygiene. To learn more, follow UNICEF and the World Health Organization for the latest updates. And if you found this video helpful, pass it along to your family and friends.
If you are a parent, chances are your word. And have questions about just how contagious coronavirus is and whether your child could be at risk. Information has cropped up across the internet saying coronavirus, or COVID-19 as it's now called, began spreading. So we asked UNICEF Health Express to get us the facts. You are sick, things you should know. The virus is transmitted through direct contact with respiratory droplets from an infected person and by touching surfaces that are contaminated. Tell your children to maintain at least 3 feet of distance between themselves and people. Were coughing, sneezing, and have a fever. Symptoms of coronavirus can include fever, cough, and shortness of breath. In more severe cases, infection can cause pneumonia or breathing difficulty more rarely. The disease can be fatal, but that mainly among adult people with pre-existing condition. Wash your hands frequently for at least 20 seconds using soap and water or an alcohol. Base hand rub, cover your mouth and nose when coughing or sneezing. As your elbow, like this. Hand washing is actually more important if you're coughing or sneezing. It's advised that you wear a medical mask to help protect others. For now, there isn't enough evidence to support whether the virus is transmitted from a mother to baby during pregnancy or what impact this may have on the baby. To date, there is no specific medicine to prevent or treat the new coronavirus. If you found this video helpful, pass it along to your family and friends.